Hey guys, Alyssa Q in here. Welcome to the Senior Rehab Project, the podcast for the community of rehab clinicians working to advance the care for older adults. I'm your host, Alyssa, and this is the Old Not Weak segment. In today's episode, I wanted to talk about, I came across a study called the Generation 100 study led by Wrightlow et al., and it was in 2018. So it was fairly recent. So first I'm just going to kind of discuss what the study found, and then we will go into how it directly applies to us as clinicians. So the main purpose of this study was to understand how older adults exercise and what they prefer to do when given choices, and then use that information to increase adherence to public health efforts, to increase and develop exercise programs, because as we know, most older adults, most of the ones that we see, especially in physical therapy, don't exercise as much as they should. So they wanted to kind of see what they would be most successful with. So they had three groups. They had a control group, then they had a group that went into high intensity interval training, and then a group that went into moderate intensity training. And so what they did, they took a bunch of older adults, ages 70 to 77. There ended up being, after dropouts and things, 618 that participated through the whole thing. And they took each of those groups, the high intensity and the moderate intensity, and followed them for 1 year. And following them basically means taking baseline measurements, having them fill out an exercise log, and then doing measurements at the end. So they weren't necessarily concerned about the results of the study, of the, if they got stronger and whatever. They were more concerned of what kind of methods that they chose to do and how many of them actually adhered to this program. So, and, in exclusion to this study, they excluded people with dementia, heart failure, and uncontrolled high blood pressure with a bunch of other things. So pretty healthy older adults. So in the high intensity training group, they did 2 weekly 40-minute workouts. They could choose group classes or individual. The main requirement was you needed a 10-minute warm-up, 4-minute working periods, 85 to 95% of your heart rate, or a 16 on the Borg test, and then 3 minutes active rest. So they did have, group classes that the participants could attend, but they also could just work out on their own. The modern intensity group, they just wanted 2 times a week of 50-minute continuous at about 70% of the max heart rate, and they trained them on how to discern the max heart rate, or to use the Borg and to kind of understand that. So then they looked at a few things. So one of them was exercise choice. So in the people that were in the high intensity group, they chose, so across all groups, walking was the most common choice. But in the high intensity group, we had walking plus resistance training was the most, the higher tendency. They also had a higher tendency for cycling, and then jogging and swimming. The moderate intensity group mainly stuck to cycling, but again, lots of walking, only some resistance training in that moderate intensity group. They also looked at where they performed the exercises. So the high intensity group was mainly at a gym or at home or at a sports facility. The moderate intensity was mainly outside, so doing cycling, walking, those kinds of things. So then they kind of looked at gender differences. Women liked more group classes. Men preferred to work out on their own. And then there was really no change in the social setting, though, as far as group classes or where they performed it, so at a group or outside, or in a gym or outside, between the moderate intensity and the higher intensity. So the social setting, meaning they worked out with other people, those kinds of things. So those were about even. So then they kind of took these results and tried to kind of make conclusions based upon what they found to see what would be most successful in these public health initiatives and those kinds of things. So one big thing that was kind of interesting was they looked at how well older adults adhered to the prescribed intensity. Now, you have to remember this is all self-reported, so the exercise log, but 60% of the high-intensity sessions self-reported to a Borg greater than 15 out of 20, when the prescribed was 16, so that was fairly close. Women tended to exercise at a lower intensity than men. And then some older adults felt that they had a better chance of reaching that higher intensity in gyms as compared to just going outside and doing things. So, in the grand scheme of things, to make a general conclusion, older adults are able to perform either of these with moderate or high-intensity training without strict supervision. So we can use these now. You have to also take into account the type of patients they looked at. Now, these are 70 to 77-year-olds with not a lot of complications regarding medical history. So they are able to mostly hit those parameters and then able to choose appropriate exercises for the most part. Now, how can we take what this study found? And I will post this study in the comments so you can take a look at it and see the specifics, especially Meg, I'll respond to you in a second. So we take these generalized conclusions and we think about how we can increase adherence in our older adult patients, because for the most of the time, we have those, some of those frequent flyer patients who do really well when you're there and then don't necessarily adhere to your program once we're out of the plan of care. So one takeaway, so I thought of 3 main ones. One is using the Borg early in your treatment sessions so patients learn to understand it. This is the way that they use to measure intensity. There are other ways, but this is one that clearly was able to work for a few people. It was a fairly large sample size. So trying to introducing the Borg early in your training sessions so they learn to kind of understand the intensity levels. So then when you're prescribing your home exercise program, you can use the Borg to say, okay, this is the intensity I want you to be at, and those kinds of things. So they have almost a target. Because I feel like a lot of people, you give them, a certain number of reps to do, but are they actually hitting like muscle fatigue and those kinds of things, hitting the appropriate intensity at that specific rep range? You have no idea. And most of the time, neither do they. So they just want to, follow what you tell them. So giving them a specific target to hit might help kind of direct our older patients. And then another thing would be maybe we could, and most people, may do this, but maybe educating patients on all the options of physical activity they have. Now, I know some people are a little bit limited due to cognitive abilities and those kinds of things. But, cycling, swimming, classes at local gyms, maybe if your patient shows some interest in like working out with other people, offer them, a couple local places they could maybe go, encourage maybe joining a local gym if they would be safe there, giving them, a walking plus a resistance training program, kind of doing a little bit of interval training, or giving them, certain times to work out. So do this activity for 3 minutes. So I think those 2 big ones of educating them on all their options that are available for physical activity, not just working out in the home, because some people might not enjoy that. And then also introducing the Borg early So then you can give patients a target to kind of work towards, to say, okay, this is the prescribed intensity you need to hit. And then they can also relate it to other activities. So, like if you want to have someone cycle, at a Borg of 16, like in the study, but they could also walk and still try to get that Borg of 16 kind of thing. So, kind of explain to them. Now again, I'm not saying this is going to work for everyone, because we do see, quite a few people that wouldn't be able to understand this concept, but I think those two main ideas could help us, increase our adherence to home exercise programs, to prevent some of those frequent flyers to come back to us. So thanks everyone for listening. I will post this study down below and clarify a couple parameters and for you to read. So thanks for listening to the Senior Rehab Project. If you've gained from this episode, consider supporting our work. You can become a patron through Patreon, a service that allows people like you to support people like us. You can give as little as $1 a month or become a game changer for $8.99 a month, where you'll get an awesome Redefine Old mug and access to our monthly meetings. Just go to seniorrehabproject.com to learn more and find the show notes for this episode. Thanks, and talk to you guys soon.